This is a case study of a 46-year-old female that I saw in my practice with chronic, I'm talking about years of left shoulder, left neck, left rib cage area in the back pain, and with occasional but frequent left-sided flank pain going down the glute to the lateral thigh and inside of the knee with tightening in this area. So the reason I'm going over this is because you guys have asked that you like case studies, and this is just a good way to see if you can relate to any of this and understand what it takes to solve a problem, because you may show up at a practice and complain of a chronic left shoulder, and then you expect a magic to take place, when in reality this is going to show you exactly the depth of what we have to look into. So this 46-year-old female came to my practice, having seen many providers, from regular physical therapists to McGill to chiropractors, osteopaths, from physiatrists and specialists, including orthopedists. This was from LA. I'm in Irvine, Orange County. So when I evaluated this individual, she was highly frustrated. She was an active individual, doing a CrossFit and very active, wanted to be active, and of course she should be active, but she was not able to do these things, and this was very disheartening for her. She showed kyphosis, so she was slouched a little bit. She was in a good shape, but she had extra curvature in her mid-back that just didn't fit the rest of her physique. Was able to do many of the exercises correctly and was highly determined to want to overcome this issue. She was very, very motivated, and she was very much willing to do what it took to take control and become active again. She had a sitting job, a hybrid kind, and had not done much exercises the last few months to the level that she wanted. She was highly aware and educated about the body, and just having experience or listened to what she had done, she was not just going from whatever insurance company had paid for her, but she had gone out of her way, out of pocket, to see really good providers, and those providers had done a great job, but they had missed quite a bit. So when I did my examination, I used methods like dynamic neuromuscular stabilization exercises to locate the level of dysfunction, what she was able to do, what she was not able to do, and that gave me quite a bit of insight as to the movement patterns that she had and the dysfunctional movement patterns that she was experiencing without realizing. So when it came to the treatment, I had to do quite a bit of things that basically she had not done. What we had to work quite a bit was a lot of active release techniques and a lot of soft tissue work, just to break down some of the adhesions and some of the scar tissues that she had. We then proceeded with occasional adjustments of the neck, mid-back, and the lower back, but really it was the mobilization of the shoulder joint, the scapula, shoulder blade, and the neck that was quite helpful. The one thing that I forgot to mention to you was that she had radiation down the arm, but her MRI of the neck showed disc herniation. And this herniation was at the site of C5, which is in the middle of the neck, and something that is very common. So I have noticed you don't have to really injure yourself doing a physical activity. It could just be from her using the devices, and she did use the devices quite a bit, but she did take quite a bit of breaks according to her, but the damage was already done. So my approach was multifaceted. I wanted to get rid of some of the scar tissue. I wanted, or at least loosen up the soft tissue. I wanted to floss the nerve, specifically the nerve that the MRI was supporting to be influenced, and I did want to bring mobility into the picture. So nerve flossing is something that I asked her to do down the road. So I started with biological breathing, which is so crucial. I'll make sure that I put biological breathing at the end of this video. And then so biological breathing we started implementing the developmental exercises like dynamic neuromuscular stabilization. My interest was stabilizing the neck, stabilizing the mid-back with that extra kyphosis and that extra curve. It was important for her to be able to manage her shoulder blades better and the mid-back better. Interestingly enough, every time we do it and I would add a load to the challenge, she would feel it all on the left side. So it was very clear that her obliques and her lats were on the left side were not functioning properly, and obviously this was as a result of the injury that she had which started all of this when she was lifting a weight and it just seemed like the shoulder had dropped down, according to her, though there was no indication of any tears or whatsoever in the shoulder region. So soft tissue developmental exercises like DNS, we started doing it midway. I mean, once we got to about 7 or 8 months of developmental exercises, not doing it, but 7-month-old movements. I shouldn't say this, let me back up. It's the movements that we did when we were 7 months old, that's it. When we got to that level, then I started doing further mobilization of the shoulder blade, and we started incorporating nerve flossing. C5 nerve flossing is the one I did. I'll make sure that we put that at the end of this video as well, just so you get to see what that looks like. By the way, if you have not subscribed to my channel, make sure you do so. My channel, the YouTube channel, is my favorite because I get to run my mouth and show you some of the things I do. I can explain things a lot more detail and not have to worry about the time. So make sure that you turn on that notification bell as well. But moving on, once I started doing the soft tissue, she had a really good jump, and then I hit her with more challenging developmental exercises. There was a lot of soft tissue work that was done, and the work that we started doing was essentially with lightweight. We're talking about 5 months, and I had her do again different exercises modified to her level, again offshoot of developmental exercises. The reason I'm such a big fan of developmental exercises is because these are the same exercises that got us from helpless infant stage to running toddler stage. No bands, no weights, no gyms, no guidance. So we're hardwired to do it. So why am I reinventing the wheel? I just need to, that's the manual of movement. So I want to know, what does my patient, how does this patient move according to this manual? Because that shows quite a bit of information that is necessary to help, so we're not just randomly shooting in the dark and hoping it's going to stick. So once I got her to that level and I started upping the challenge with some weights, and I started having her do the exercises, she very quickly, and I use an app to study how they exercise, and we evaluate with the patient, I evaluate their performance. We very quickly notice that when it comes to upping her game, so if she's cycling or if she's jump roping, which is something she wanted to do, we could see that the body it's just too advanced for her that stage to be performing those things. Certain things needed to be in place. That doesn't mean she doesn't need to, or she will never get to do those exercises. It just means that it was too early. And it's so important to recognize that what your long-term goal is may not happen today, but that doesn't mean it will not happen again. So once we started doing this, now I started adding more and more exercises like modified plank and plank, which, by the way, you did. Modified plank is what we all did at age 6 months. We did plank before we started walking. So these are all based on the developmental exercises and the principles that are involved in them. If we follow those principles correctly, we have no choice but to improve, because that is the method we moved to begin with. bottom line here is, and the good news with this patient is that she is really doing well. She has been very patient. I have been very involved in educating her, because at the end of the day, when it comes to these physical issues, this movement issues, you have to understand this is like driving a car. Once you learn how to drive a car and you exhibit understanding of how to drive, you can drive in your state, in your town, or a different country. Those principles apply. Maybe some modification, but there is across the board, you can drive anywhere. Same is true with movements. If you understand what right looks like, what your version and your tendencies are, and you replace your wrong with the right, and you're always mindful, then you can control the future of your movement patterns and the injuries or rehabilitation. You know, at some point, you have to understand that, let's say going back to the driving, it doesn't matter how many years you've driven, it's never okay to pass a red light. So it's never okay to downplay those principles that are so crucial in getting you to a good level of movement and no injuries and more activities. So in this case study, I decided to share with you because the things that she had in her legs, around the knee and in the back of her legs, back of her back, they all disappeared once she started moving according to the proper movement patterns. So you have to understand your body does not work against you, it works for you if you provide the right environment. Provide the right environment and you will see the best results. And in my opinion, and from 30 years of practice, I can tell you the right environment are the environment that already have produced the results we're after. We were helpless infants, hardly being able to hold our heads up, and we became running toddlers automatically without anyone coaching us. So we're hardwired that way. That is the methodology, and that is the principle that I use in handling chronic patient cases, and most importantly, them understanding how to carry the torch and move on so they don't have to keep provider hopping from one injury to another injury. Thank you so much for watching. Let me know what your comments are. Let me know if you have any specific requests for case studies, and I'll see what I can do. Until next time, take care.